Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been performing cosmetic or plastic surgery in the Scottsdale Paradise Valley area since 1992, and all I perform is cosmetic or aesthetic plastic surgery. I'm here in Scottsdale, and you can't be a plastic surgeon in Scottsdale, Arizona without doing a lot of breast surgery. I perform tons and tons of breast augmentation, and once again, currently, when I'm making this movie, I've been in practice for 22 years, and there's thousands and thousands of breast augmentation. You know, everybody's impatient. And a common question is, how long can I expect to be uncomfortable after breast augmentation, and how long before I can get back to normal activities in terms of lifting, in terms of doing any sports, in terms of feeling more normal? Um, the way to answer that question is to understand what I'm doing with breast augmentation. If I am putting a breast implant above the pectoralis muscle for some reason, that recovery is quite simple, and it really is literally days before you're feeling completely back to normal and you can resume more normal activities. There are a slew of different implants that we use now, some of which are textured, some of which are not, that may require some massaging technique every day after surgery. But generally, if your implants are above the muscle, you can get back to a more normal activity almost immediately. We like to have people massage, but with regards to lifting and any sports activity, almost immediately, I say within the first week or so, you can get back to your schedule. Now, the majority of the implants that I put in are beneath the pectoralis muscle for reasons that they tend to stay softer longer. In most patients, they tend to look a little bit more natural. And the capsular contracture rate, which is the hardening, is less when you put them beneath the muscle. But everything has a price. So when we go beneath the muscle, I'm actually elevating the muscle and partially removing it from the chest wall. And there are some, not problems, but trade-offs with that. I think it's more uncomfortable for the first week or so. Generally, people that have not had children, I think it takes about a week before you're feeling, 100%. In people that have had children, it usually takes a couple of days. We often have to deal with muscle spasms, so we give Valium to help decrease those spasms. But lifting and activities that way are somewhat limited. Generally, within the first 3 weeks or so, when implants are put beneath the muscle, we like the patient to wear a bandeau that helps push the implant down to fill the most inferior portion of the pocket. When lifting, and a lot of patients have very young children, we like to have people keep their arms close to their body to use their core body for leverage instead of using their arms and the pectoralis muscle. And gradually people can start doing more activities. Within the first 2 to 3 weeks, people can start running. Usually people wear a couple of sports bras for extra support when the implants are beneath the muscle. And it takes a while for those implants to go from a higher position to a lower position. By about 6 weeks, I feel comfortable for people using their pectoralis muscle more liberally in terms of doing chest exercising and doing almost any activity that you want, with the thought that there might be some discomfort, usually which can be treated with a non-steroidal anti-inflammatory drug, whether it be Motrin or Aleve or anything of that sort. But all in all, it depends upon where the implants are placed. It depends upon whether you've had children or not. And it depends upon, once again, communication, so we don't take a step forward where you do too much too fast. But overall, patients generally get back to doing whatever they want by about 6 weeks. In that meantime, we try to slow you back a little bit so you don't find any discomfort. And sometimes when people do a little bit too much too fast, those implants will stay a little bit high too long. And that's what Valium is for. But the best way to understand is come in and talk, and we get it going that way. Thank you.